Everything you need to know about whiplash. What is whiplash and how to self-treat it. My name is Adam Smith-Connor and I have over 30 years experience as a chartered physiotherapist treating this painful neck condition. Every day in Britain there are 900 crashes, 5 fatalities and 80 serious injuries. There are 1,500 whiplash claims, and the whiplash insurance cost is £2 billion per year and adds £90 to every individual's insurance premium. Whiplash is caused by a sudden forwards and backwards movement of the head or a side-to-side movement. That could be caused by a sudden deceleration, as in a car impact, or it could be from a blunt trauma, maybe hitting your head on a door. All car insurance premiums will cover you for whiplash. So if you've sustained a whiplash in a car crash, it is always worth making a claim. There are ways of reducing the impact of a whiplash injury if you're aware of the safety features within your vehicle. The headrest isn't there for your comfort, it's actually there to reduce the impact of a whiplash. We can see here Patrick's head is lined up with the headrest here. You might have to adjust the height of it in your own vehicle. By having it at this height, Patrick's head, when it comes back, is going to be restrained by that headrest. Whereas without it, if you just lean forwards a bit there, Patrick, and then lift your head back, his head's going to go back a lot further, causing more of an injury. In front, we have the air bag. When your vehicle has an impact at a certain energy level, that airbag will deploy. A big balloon comes up here, and that is going to cushion your head and your body as it comes forwards, preventing your head from hitting the steering wheel. Some vehicles will have side impact airbags as well. The crumple zone at the front of the vehicle will absorb a lot of the energy of an impact. Also, be aware of loose items within the vehicle. The rear passengers should wear their seatbelts because they will come forward, hitting the passengers in front. Any cats or dogs that you might have in the vehicle, any animals, you want them to be restrained, perhaps having a cage so that the dog doesn't come flying through the vehicle. And any items of furniture as well need to be strapped down as best you can. Whiplash symptoms don't always appear immediately after the crash. It can take 6 to 12 hours before neck pain starts to set in. This is because it takes time for the inflammation and muscle spasm to kick in. This will result in neck stiffness. Pain can radiate across into the shoulders, and you'll get reduced range of movement. You can get pins and needles and numbness down into the hands and arms, and it can also radiate up the back of the neck into the head. In order for the head to be stable on top of the cervical spine, it has to be supported by a lot of muscles, bony joints, ligaments and tendons. And in a whiplash, when your head is suddenly thrown forwards and backwards or side to side, those muscles and nerves will be strained and damaged. In a whiplash, what we have to remember is you're traveling forwards. Your head, your skull, 5 kilogram skull, it's traveling forward at say 40 miles an hour. You then hit another vehicle and very quickly you're going from 40 to 0 miles an hour. But your head is still going at 40 miles an hour. So your body will stop, your head will still go, it'll be thrown forwards. There'll be a reflex contraction backwards, putting it back like so. That's where your headrest comes in to prevent it being thrown back too far. And then you'll probably have a recall back forwards as well. Same side to side. If you have a side impact, it'll just do the same. Initial treatment could be something like ice, which is good for reducing inflammation, and heat packs such as a hot water bottle, which will be very good for reducing muscle spasm. Simple painkillers such as paracetamol or non-steroidal anti-inflammatories such as ibuprofen may be appropriate for the first week or so to help reduce inflammation. If it's very severe pain and it was a sufficiently bad car crash, you might end up going to A&E, where they will assess, possibly take an x-ray if they think there might be a fracture. They'll assess your nervous system to make sure there's been no damage to the spinal cord or any peripheral nerves. But assuming none of that has happened, and it's just a simple, straightforward whiplash, then you need to get that neck moving within the limits of your pain as soon as possible. It used to be that we would issue people neck braces. We do not do that anymore. In the past, what a neck brace would do is it's comfortable, certainly, but it does tend to cause the neck to stiffen up and for the muscle spasm to get worse. Other treatments you could apply are things like muscle rubs, like deep heat, or I supply a CBD gel that can be very good for reducing inflammation and pain. And you also need to start doing neck exercises as soon as possible. And my assistant here is going to show us some neck exercise. I'm just going to describe some neck exercises. Okay, so Patrick, what I want you to do, you're going to sit nice and upright. And first neck exercise I want you to do is you're going to turn your head to your right as far as you can. Just your head, not your whole body, but just your head. So just turn your head to the right as far as you can. Good, excellent. And then you're going to turn your head to the left towards me as far as you can, stretching as far as you can. Excellent. And then back to the middle. Okay, and then Patrick, I want you just to look down as far as you can, and then up at the ceiling as far as you can, right the way up. All the way up, look up. That's it. Looking up as far as you can, and then back to the middle. And then side flex as far as you can to the side. So sit upright, up, that's it. And then you're going to side flex that way, and then side flex towards me as far as you can. That's it, good. And then back to the middle. Okay. So what we're doing there is we're just getting all the movements of the neck and just maintaining the movement as much as possible. You can stretch it a bit more by pressing over with your hand. Okay, so Pat, just shuffle back on there a bit, nice and upright. And then if you look over your left shoulder, and then I want you to press and look at. So with your hand, you're going to press. Put your hand on your chin, and you're just going to press on your chin. Look over that way as far as you can, and you just press, stretching it around. Good. Back to the middle, and then you're going to look back towards me, and then press with your hand, and stretch on the chin, and then just stretch this way as far as you can. Good. Back to the middle. And then you're going to stretch across and pull across. That's it. And you should feel that pulling in the muscles there. Back to the middle. And then stretch the other way and pull across the other way. Hand on top. Stretch across. Good. That's fine. And then back. That's fine. Back to the middle. There you go. Sit upright. And then you're going to look down and pull down. That's it. Good. And back up. Good. And then look up, and then you might push up. Push up on the chin. That's it. Good. Back to the middle. Okay. The other exercise to do, because we often get a lot of spasm in these upper trapezius muscles, is to do shoulder rolls. So just rolling the shoulders. So Patrick, can you just roll your shoulders? Like so. That's it. Just rolling the shoulders. Excellent. Good. Okay. Good. Chin retractions are very useful exercise as well. Often with a sore, stiff, muscle spasmy neck, you get a bit of a pokey chin. So we just tuck the chin in, like so. Can you just try that, Patrick? So you just tuck your chin in. So you keep your head level. Keep your head level. Okay, sitting upright, and then you just tuck the chin in. Don't look up or down. That's it. And then relax. Tuck in, and relax your shoulders, tuck your chin in, and relax. Tuck in, and relax. So it's a horizontal movement. So you don't look up, and we don't look down. tucking the chin in. Okay. Sleeping position will have a big impact on whiplash. If you've got your head and neck in a good comfortable position in bed at night, then you're going to recover far more quickly from your whiplash. We've got here a cheap old pillow, and we can see from this that Patrick's head isn't in the ideal position. What we want to do is try and maintain a good spinal alignment so the head's not flexing one way or the other. So if we just change this pillow for a groove pillow, the material in the groove pillow is a lot firmer, and we've got this groove shape here that will help to support his head. If I just take that for a moment, Pat, we can see there's a little indent in the pillow for where his head goes and for his shoulders here. Put that back there. So that it holds his head in a neutral position. Pat, if you just roll onto your back, right on your back. Patrick's a child, so this pillow's a little bit too big. Is flexing his head forwards a little bit too much. Somebody like myself, obviously I'm an adult, a large adult, I would probably need a bigger pillow. The advantage of these groove pillows is you have got these sort of wedges you can place within the pillow to make it thicker and better supported. So we see here in this position, his head and his neck should be in a nice alignment. You can order one for yourself with free delivery from the Groove website using the code here. So it's P-FPS. And the website for these Groove pillows is www.groovepillows.co.uk. So make sure whether you get a Groove pillow or some other pillow that you have a good supportive pillow. Physiotherapy treatment after a whiplash can involve massage, where we just massage into the neck muscles. Spasmed tight muscles feels a bit like trying to massage a block of wood, whereas supple, loose muscles feels like kneading bread, kneading dough. We make the mobilization, where we just press down into these neck muscles. One treatment that we use as well. If you've got a lot of inflammation and it's very tender and painful, we might apply something like a TENS machine or possibly ultrasound in extreme cases to reduce inflammation. At the end stage, we may use various different manipulations. So I'm going to support Patrick's head here, and we might do something like traction. Pop your knee down, Patrick, where we just pull on the neck like so, stretching out the neck muscles, stretching out the joints in the neck, and then we could do a bit of rotation where we rotate the neck around like so, or some side flexion where we side flex like so. So physiotherapy is a very effective way of treating the muscle spasm and stiffness and pain that can result from a whiplash injury. I hope you've enjoyed this video about whiplash and everything you need to know about whiplash. Please do remember to subscribe to the channel, give us a like, and look us up on the internet, www.newforestphysio.co.uk. I'm based in Marchwood near Southampton, and if you've had a whiplash injury or any other kind of neck pain, please do give us a call on 023 8008 9120, and we can help to treat that. And don't forget, you are covered for your whiplash on your car insurance. Thank you, and see you in the next video. Would come up against the headrest rather than being thrown all the way back. So Pat, if you just come forwards. Come on. Once you sustain a whiplash injury, Okay, come on. Keep recording.
I'm trying.
Okay, ready? Right.